This is a diabetic ketoacidosis tutorial presented by the SchrDbb with reference a practical guide to issue taking and clinical examination by Anwokia Salon. So, diabetic ketoacidosis. Diabetic ketoacidosis is a condition that occurs in children with diabetes mellitus due to severe insulin deficiency or insulin inefficiency. Mostly is due to insulin deficiency. And now this is different between diabetic ketoacidosis, which is one acute complication of diabetes, and we have HONC, which is hyperglycemic hyperosmolar non-ketotic state. We need to know that what in case of HONC, you have insulin production. When you have diabetes in old age, you still have insulin which is produced, but you don't have a responsiveness to insulin. Are you getting? Since insulin is produced in that case, insulin is going to inhibit ketosis. So that's why in older age you have hyperglycemic non-ketotic state. But in younger age you don't even have insulin, and there is no insulin to inhibit ketosis production. So that's why you have diabetic ketoacidosis in young age. So diabetic ketoacidosis is common condition that occurs in children with diabetes mellitus due to severe insulin deficiency or insulin inefficiency, although generally resulting from omitted insulin injections, stressful condition, unsuccessful management in current. So due to is mostly associated with type 1 diabetes, but can also be associated with type 2 diabetes, where when there is no more production of insulin in type 2 diabetes. It can occur in about 20 to 45% in children with new onset diabetes. The criteria for the diagnosis of diabetic ketoacidosis include: 1, you must have your serum glucose. So this is the criteria of diagnosis of diabetic ketoacidosis. Your serum glucose should be greater than 200 mg per deciliter. Your pH should be less than 7.3, and your bicarbonate, your pH should be less than 7.3, or your bicarbonate should be less than 15 milliequivalent per liter, and you should have ketones both in urine or blood. So, and your ketosis in urine, the urine must be at least 2+. So that's the triad for the making a diagnosis of diabetic ketoacidosis. And now to make a diagnosis of a hyperosmolar hyperglycemic non-ketotic state, you should have at least a serum glucose of greater than 600 mg per deciliter. That's 1. 2, you have your hyperosmolar state, meaning that the osmolarity of the blood should be greater than 320 milliosmoles per liter. And the third one is you should not have any ketosis. So those are the 3 main criteria, and you should have any ketosis and no acidosis. So the issue taken in diabetic ketoacidosis, you have identification, you have chief complaint. The chief complaint in diabetic ketoacidosis is due to the hyperglycemia. It's due to the triad of hyperglycemia, ketosis, and acidosis. Acidosis is going to result to nausea, vomiting, abdominal pain. Are you getting? And then hyperglycemia is going to result to fatigue, is going to result to excessive urination, is going to result to excessive fluid intake, hyperglycemia. Acidosis now is going to result to fast breathing, is going to result to air hunger, is going to result to headache, is going to result to drowsiness, and is going to result to coma. So that's a triad. The first one is acidosis. Acidosis is going to result to nausea, vomiting, abdominal pain. Hyperglycemia is going to result to fatigue, excessive urination, and excessive fluid intake. Now, still acidosis is going to result to fast breathing, air hunger, headache, drowsiness, and coma. So on the issue of presenting complaint, observation of symptom, initial level of blood glucose and ketones. You have fruity smell on the breath, that's ketosis, fruity smell on your breath. You have issue of weight loss, nocturia, nocturnal enuresis, polyuria, polydipsia, polyphagia. You have presenting symptom, non-compliant to insulin, 1, trauma, surgery, anything that can result to stress, like trauma, surgery, psychological stress, excess exercise. You have infection, intercurrent illness, and pregnancy. So past history, you have new onset diabetes, age, you have age of onset of diabetes, initial manifestation, initial investigation, hospitalization, date, course, duration, progression of the condition. You have frequency of hospitalization, patient condition between the attacks, self-monitoring blood glucose level. You have polycystic ovary syndrome. You have polycystic ovary syndrome can be associated with diabetes mellitus. That's the point you have to look in mind. Every recurrent infections, you have renal disease, medication, detailed insulin therapy, and all that. Developmental issue, developmental delay, school progress, growth delay. Now, what are the key points to note with diabetic ketoacidosis? A child with diabetic ketoacidosis can present with a variety of symptoms depending on the severity of the condition and the age of the child. Older children may present with polyuria, which occur in spite of the state of clinical dehydration. Polyuria, though the child is still dehydrated, due to glucose-induced osmotic diuresis. So this helps to differentiate diabetic ketoacidosis from gastrointestinal disorder, e.g. gastroenteritis. So you have polyuria, though the child is dehydrated. So we have, and because the gastroenteritis here, you realize that what you still have vomiting, diarrhea, abdominal pain, just like gastroenteritis. But in diabetic ketoacidosis, differentiating because you have polyuria, addition to the signs of dehydration, addition to gastroenteritis. So other symptoms are polydipsia, fatigue, nausea, vomiting, abdominal pain, deep sighing, respiration, asking small breathing, acetone odor, somnolence, disturbed level of consciousness. In infant, decreased activity, irritability, weight loss, dehydration may be presenting symptoms of diabetic ketoacidosis. Duration of symptoms vary with age. It may be day in toddlers or months in adolescents. Weight loss in child with diabetic ketoacidosis may be due to dehydration and loss of calories. In child with diabetic ketoacidosis, a history of severe headache or any decrement in consciousness level raises the concern of cerebral edema. So if you have severe headache, loss of change in consciousness level, you should think of cerebral edema and it's child of diabetic ketoacidosis. So the next thing you're going to visualize is failure to thrive. Thanks for your kind attention.